Okay, hi Catherine. So this is my little baby. He smells a little bit like a cedar chest. I haven't given him a name, but we'll just call him little baby. So baby came out of his mother. We immediately, first of all, we had the room good temperature, blankets pre-warmed, and the temperature of the room, I think about 75 Fahrenheit, 74 Fahrenheit. And as soon as he came out, he was placed on his mother's belly, as is normal for a brand new baby. And during that time, we were able to see that he was male, um, so assess his gender, and able to assess for any deformations, malformities of any kind. We pretty much immediately can see quite a bit going on as he's cleaned off and scrubbed down a little bit. And we're able to watch his respirations and count them, although we would probably do another count within about an hour after he was born, and even probably right after he was taken from his mother as well. Keep nice watching his vital signs. So we're able to look at the rhythm of his respirations, um, and able to assess his crying and see that he has a nice, good, strong cry. So after all that, and he's placed inside his nice warm blankets, prior to any assessment, we'll have good hand hygiene and make sure our hands are good and clean. And then we'll start going through all of the pieces from head to toe. So we want to look um, right now while he's here. We can see that he's a beautiful pink color. He looks great. His eyes are clear and open. His ears are even. He has symmetry about his face. His head is nice round. It's not too large. It's not too small. We'd like to measure, and if I had tape measure, I would simulate that, but I don't have any. But we would measure his head, and we would want to see about 33 to 35 centimeters, and count his respirations, which we would want to see at about 30 to 60. It's a wide range, so we would continue to assess his cry, and we would also assess, as we pull the blanket down, we'll talk about all that stuff, but we want to assess his movement and some of his reflexes and things. So during this time, we're going to listen to his heart, and we would carefully uncover only those areas. So we'll listen to his heart, and we'll listen to his bowels, and then we would see if there's any gluing at his hands or feet, which might be normal right after birth, but that should return to nice pink color soon. And then we can test his Babinski reflex and his palmar grasp, and this is where we would look for his reflexes. Well, it's that part of the APGAR scoring. His activity, his muscle tone, that's the word I was looking for. So we want to assess his muscle tone and see if he's able to move everything, and see that he doesn't have any big floppy limbs. And we want to see that he's able to move his head around a little bit. And if we turn his head, we might see a reflex where his arm comes out. That's a normal sign. With the Babinski, we would see his foot fan out. We would listen to his breath sounds also. I should have done that while doing his heart. So that would be something we would do all at the same time. We'd listen to his breath sounds. We might even be able to listen to some of his breath sounds as he's getting cleaned off, and listen to his back while he's on his mother. We would be listening to his back as well. And we would get his temperature, which we would like to see around 97, 97.7 to 99, and his blood pressure. Blood pressures can range from 80 to 60 over 45 to 40, and there's a lot more of a range than that, even if depending on the source. Um, so we would just look for uh, just assess any meconium that might be present. Is he urinating? Is he sucking when he's put to the breast? Um, how does his skin have any spots or anything on it? I know I'm kind of going out of order, but it's some of the stuff was put in a different area than I had it kind of laid out a certain way. Sorry. Anyway, I could redo it all day until it's perfect. So I think I'm just going to keep moving. So anyway, during the whole skin assessment, we would look for all those things. As we got him dressed and everything, we would also look for all that stuff. Um, we talked about his plantar and his Babinski reflex. And the other one that I wanted to mention, oh, and his sucking reflex. The other one I wanted to mention was the Moro reflex, which is the sudden reaching out with all limbs, and that's a very normal sign and good to see in a newborn baby. And we want to check and make sure that there's no jaundice when we're looking at the skin. So we talked about the fact that his eyes were clear, that indicating that there's nice white sclera and we don't see any yellowing of his eyes and yellowing of his skin, of course. Um, and yeah, we've talked about everything. Symmetry, muscle tone, his APGAR score, oh, and his heart rate. I didn't mention that, so we'd like to see a heart rate, oh, between 120 to 160, and we'd like to keep him covered to keep him warm so he doesn't lose his heat, because babies can lose their heat very quickly. Um, that's about everything. His abdominal cord looked good. Um, he's got a good strong cry. He wants to turn his head towards his mother's breast when we put him to her breast, and able to suck, and mother bonds with baby. So those are all the things we'd like to see in a newborn assessment. And I'm sure I'm going to learn a whole lot more tomorrow. All right, thank you. Bye.